It's now about a month after national restrictions were finally lifted on the 19th of July. And to some extent, many people have gotten back to life as usual. It's easy to forget about COVID. It's easy to think that it's all over and we can now go back to life as normal. However, that would give a very false impression of what was going on in Torbay. For those of you who have been following our case numbers, you will note that our rates of infection have remained relatively high, certainly during that period. And in fact, for most of August thus far, we have had case rates above 400 cases per 100,000 in the last 7 days. That represents a figure which is about double the case rates at our previous peak in January. The pattern of infection is similar to what we've always seen. It's mainly people who are under 40, largely younger people. Typically, the peak ranges is teens to mid-20s or thereabouts. And there are several factors that are related to that. The Delta variant clearly transmits more rapidly. We know that in Torbay, there's a higher proportion of our population that work in face-to-face occupations, particularly around hospitality and retail, tourism sectors. And that age group, that kind of work means that people are exposed to individuals on a daily basis. When the background rates are high, the risk of transmission increases. The result is that Torbay remains in the top 10 areas in England in terms of our case rates. The positives, however, are that our vaccination uptake is very good across all age groups. Our vaccination uptake tends to be higher than the Southwest average and the average for England. And we also know that the vaccine is offering protection to those who have had both their jabs. And we see that in terms of the cases that are coming through. Our infection rates are much lower in the older populations where vaccination rates are over 90%. However, the vaccine program on its own is not going to offer 100% protection. And unfortunately, we have seen an increase in hospitalizations. Now, the level of hospitalizations that we're seeing are very much lower than we've experienced in previous peaks. And for the level of cases that we're seeing, we would have expected much, much higher hospitalizations. The fact is, however, that in previous waves, the NHS was concentrated largely on COVID to the exclusion of much of the other activity. We're in a very different place now. The NHS is dealing with the backlog of cases that had to be deferred. It's trying to restore quite a bit of activity that had to be postponed, while at the same time getting ready for the typical pressures of winter. Even a small number of additional COVID cases puts extreme pressure on a system that is already pressed to its limits. And that's what we're seeing across the NHS. So it's important that although the vaccine is giving that protection, that we still work as much as possible to reduce the number of hospitalizations that we see because of our very high background rates. We didn't have any COVID deaths for several months, and unfortunately, in the last 5 weeks, we have had 6. That number is still thankfully small, but for those individuals, for those families and loved ones, this is still a grief. This is still a tragedy for them. And we want to do as much as we can to reduce the COVID-related deaths as we go forward. We know that the vaccine program is key to achieving that. But it is also important that we do the best that we can to keep our background rates low, because we know that there are a number of people who, for a variety of reasons, may not be able to be vaccinated or may not mount a full immune response, and therefore are vulnerable because of their underlying health conditions. It's important, therefore, that we try to do the best that we can in keeping our background rates low, in behaving responsibly that allows those people to have more freedoms and to enjoy some of the freedoms that the rest of us may take for granted. On the 16th of August, there was a change in terms of self-isolation. Those who have been doubly vaccinated, who are at least 14 days from their last dose, their second dose, do not need to self-isolate if they're contact of a confirmed case. The same applies to anyone who is under 18. However, it's important to recognize that if any symptoms develop, however mild, you should have a PCR test. You should isolate until you have the result of that test. For those people who are doubly vaccinated, who are under 18 and therefore exempt from self-isolation, there's a strong recommendation that you do get tested with a PCR. And in fact, it would make sense that you look at your social contacts and reduce those until you are confident that you have a negative PCR, because we know that people can transmit the infection even when they do not exhibit symptoms. It is still important to try to do everything we can to limit the transmission of COVID. Some time ago, the COVID app was in the news because of the pinging, and some people may have been tempted to turn it off. We want to encourage people to turn back on the app. It does a lot more than just alert you to whether you were a contact of someone who is positive. It's important that we respond to any messages. If we are exempt, then we can take the advice to be tested, get our results. If we are in particular settings where there are vulnerable people, etc., NHS Test and Trace may wish to contact us and give us that advice in terms of what we need to do. I want to encourage everyone to report tests, that continue to be tested where relevant, where if you're symptomatic, report those tests through so that the NHS Test and Trace and our own local contact tracers can follow up and ensure that anyone who has been in contact who is legitimately at risk can take the appropriate actions. We want to continue to work together to act responsibly so that we can protect ourselves, protect our loved ones, and the wider community. We want to continue to be a safe and welcoming environment for our visitors. We know that our hospitality sector or tourism sector has been working very well and very consistently to keep visitors safe. And we know from the contact tracing that we've done locally that that sector has very low rates of infection. We've not seen tourism being a major contributor to our cases. It continues to be social contacts and household contacts, largely of residents and of loved ones, where we see the most of our infections in the Bay. COVID is still with us, but there are lots of positive things that we are doing and can continue to do that will help us to control the situation and that will help us to protect the most vulnerable among us. Let's continue to take positive and responsible actions to manage the situation as we go forward. Thank you for listening.